again, without any scalpels or anesthesia.
So just you would just be using like a local then, just for.
Sometimes, frankly, we don't even do that. We have patients who come in at their lunch break and do this, and they're back to work later on that day. Absolutely.
It's great that you can do that. I think that getting away from, I like what you're saying about women want to look rested, but they don't want to look like Colin, my fiance goes, everyone in the city looks like they've been driving down Central Expressway 70 miles an hour with their face out the window. He's like, what's going on?
With the top down in a convertible. Yeah. That's what he says. Yeah.
I agree. And I think the nicest compliment I get from patients is that they go to work, and sometimes their patients or friends will just tell them, did you get a new haircut? You look so much better. Did you come back from vacation? Not, did you go get something done? And I think that's always the best.
I've got a great idea for you. You're having the party tonight. You go this afternoon to Dr. Sule, get all this done, and you'll show up at the party tonight. Nobody's ever going to know. And you're going to look rested
4 hours
and great.
Of sleep. That's why, I know. Well, when we come back, I want to talk about, we talked about some of the latest techniques, but I'm 42. Mom's 70. So I want to talk about the different things that you would do for different age groups, what somebody like me, I kind of know some of the preventative things to do because I'm at that age where I'm preventative.
You're thinking about it here.
So I want to talk a little bit about that and, give some advice to people out there that need some help, okay? So when we come back, we are talking today with Dr. Sandy Sule about his latest techniques and everything that he does in his office for facial plastic surgery, and he specializes in head and neck cosmetic surgery. And so glad to hear that, by the way, as you heard us talk about, because it's really important to specialize in one thing, in my opinion. So you stay tuned. We'll be right back with Dr. Sandy Sule on Ultimate Living. Welcome back to Ultimate Living. Today we're talking with Dr. Sandy Sule, who specializes in facial plastic surgery, head and neck cosmetic surgery. Okay, Dr. Sule, we talked a little bit about some new options, that liquid facelifts when we left and things of that nature, which is great to hear because, really you can go for lunch and say, hi, I'm going to lunch. I'm going to go down to the street to get a sandwich and get your face done and come back, go to work.
And they said, did you take an hour nap?
Yeah, exactly. So let's talk about nowadays, men are starting to get, more concerned about the way they look. Years ago, that wasn't the case. So talk about some options for men.
Absolutely. As the economy didn't do so well over the last couple of years, men have certainly started taking care of their looks. They know that in terms of their own job security, their own self-confidence, their looks, frankly, play an important role for it. And frankly, in terms of how they want to come across, how they look is very important in the business world. But the difference in men and women is men want to look like men and women want to look like women. So a lot of what we do in that artistic view of people is try to create a masculine look for men, but improve their looks. And we developed something called a man lift, which is basic.
A man lift.
I know,
I love
it's basic
that name.
name.
I like that.
It uses certain fillers to create this almost James Bond look, a good chin, a good jawline, a good cheekbone structure, to basically lift someone up but create that strong male appearance in them that a lot of men really like.
And you know what that also does in the workplace? Men that have that strong jawline, all that, it's shown in research statistics that they are the ones that get the better jobs. Believe it or not, is because of their jawline and the way they look versus a man that has a softer jawline or softer appearance. Also, same thing with women, dating. That's all been proven. They've done the research on that too. So
exactly. I think you'll see that even there's been studies on men who wear goatees, that the main reason men wear goatees is they just have a weak chin. And they're trying to camouflage it. So we've had a lot of patients come in who just said, my wife hates my goatee, but I don't want to walk around with my goatee because I'm embarrassed by my chin.
Well, the chin is so easy to fix.
Oh, yeah.
That's right.
It's just an easy boom, 1, 2, 3, and that's not a big surgery at all.
No, not at all. But even nowadays, we can do chin help or chin augmentation without even doing surgery. We can use certain fillers and such that creates a relatively permanent look without ever undergoing surgery. One
of the things I think that you do, I'm sure, that I think really improves someone's appearance is if you see a person that has that what is it, kind of like that, they miss their chin and then they have that kind of strange looking neck. I've seen people change their appearance having that taken care of, and it makes them look like a completely different person.
It does.
That is something, and when you're talking about someone from the side and they have that kind of swollen thing and then kind of,
turkey neck.
It's not a turkey neck, Mom.
But I know what you're talking about. I had someone just work in my office that had
but then when they get that redone, I mean, it just changes your overall, I mean, gosh, it's
amazing how much confidence someone can have with something relatively simple,
Yeah.
but makes a big difference in their life. Absolutely.
And people, I think now are starting to think about, it's not just being vain, it's about feeling good about yourself and your confidence and your self-esteem. It's not a bad thing. I mean, plastic surgery is not a bad word, 2 words. It's okay to do something. I mean, I think it's like going to the gym. You're not going to go to the gym. I mean, that's crazy. You're not going to brush your teeth. I mean, why? If you want to look better and feel better about yourself, then you should do it. I really believe in that. So.
Well, I believe so because I've seen women in this city particularly spend thousands of dollars on designer clothes, and yet, I mean, even your dad will say, oh, she really needs to have her face done. I can't believe your dad is 84 years old saying that about women. Have you told her? And I said, Glenn, no, I'm not going to tell her. But I mean, you notice things like this. I mean, I'm not going to go buy a $2,000 dress and not have a fit. It doesn't make sense. Okay, I want to ask you.
This is interesting.
Yeah, okay, go ahead. Ask that.
Yeah, okay. Surgical, non-surgical rhinoplasty.
Yeah,
what
tell me
is
about that. Yeah.
It is. So people oftentimes don't necessarily like the overall appearance of their nose, or there's one little tweak they'd like in their nose. And before, frankly, we'd always have to do a nose job, a rhinoplasty, which involved a major surgery. And sometimes, frankly, we still have to do that. Sometimes that's the best option. But in some patients, we can create a contour of their nose that eliminates humps, kind of straightens out the nose, gives an appearance of a rhinoplasty or a nose job without actually having to undergo a rhinoplasty.
Wow, so what's the downtime on that deal?
Usually it's about a day.
Okay.
People, literally we've had patients who, most recently I had a bride who came into my office who was taking some pre-wedding photos and kind of noticed her nose in her photos and just said, I don't want my wedding photos to look like this. So she did this about a week before her wedding. We did her non-surgical rhinoplasty, and she showed me those photos of her wedding afterwards, and they look great. So it's a relatively simple thing to do that makes a big difference in someone's nose. It takes us about an hour to do, and you're off again and back to life.
That's amazing.
That's great.
Wow, I can't believe that. What about, okay, let's talk about
treatments, like how long they last, like people
Let's talk about
get,
fillers.
Yeah,
so,
fillers, like
and
Restylane
the filler world is constantly changing. I mean, literally every 6 months there's a new, now it's Dysport, Restylane Juvederm, Radius, we had Sculptura, all this kind of stuff, and every day there's a new name of something. So let's talk about what's hot in fillers and what's going on with fillers.
Fillers are a very confusing thing to both patients and doctors. The reason is, there's not one perfect thing. If there was one perfect thing, there'd only be one thing out there. The reason there are multiple things out there is because each thing has its plus and its minus. The fillers kind of run in various categories, from collagen, which is the most natural, but it's the shortest lasting thing, only lasts about a month or two, to the hyaluronic acids, which are Juvederm, Restylane, those kind of names, to the calcium-based products, which are Radius in name, to other injectables like Sculptura. And their use is based on in my opinion, where you put it in the body. For certain areas of the face, certain fillers work better. In certain areas of the face, frankly, it would be a bad thing to put a certain filler in there. But they last, in general, fillers last anywhere from a year, year and a half, to upwards of 3 years. So that longevity is what's a great option for patients, because it creates a rejuvenated look in a simple way that lasts a relatively long period of time.
Now, we're still doing a lot of Botox, I know that. So explain the difference, if people don't know, between a Botox and a filler.
So Botox is a neurotoxin. It's an actual peptide, a protein, that basically prevents muscles from moving. So in the face or anywhere, lines and wrinkles and contrast are caused by 2 things, either volume or muscles. So when lines are caused by muscles, we use Botox or Dysport to basically prevent those lines from happening. And the difference between Dysport and Botox is kind of a small thing, but it's an important thing. Botox is the original one that's out there, the one that's been out there